Hi Jasmine, it's Dr. Buford. Just getting started on the right shoulder. We're looking in from the back to the front. We examined your shoulder before we started and confirmed that you have instability not only to the front but also to the back. As we look in the front of the shoulder, just to orient you, you're laying on your side, your arm is up in the air. So the humeral head, the ball part of the ball and socket joint, is at the top of the screen. That's interesting. Right off the bat, we can see a little bit of fraying of the labrum there. We'll be dealing with that. And then as we look towards the front here, we can see a little bit of fraying in the undersurface of the rotator cuff. We'll put in a shaver here and just debride this. Usually this isn't something that needs to be repaired. We just debride it to make sure we can see. Yeah, so the other thing that you have that's interesting is your biceps tendon insertion is not the typical insertion. Your biceps tendon is actually inserting into the undersurface of the rotator cuff. So your tendon's really coming down on the left side of that great cannula, but you can see there's no tendon insertion into the superior labrum here. Normally the biceps inserts right at the tip of the great cannula, and you don't have that type of insertion. This is really inserting into the undersurface of the rotator cuff. And really nothing to do for it surgically at this point. Pull back on the brace just a little bit. But it is interesting to note that you're one of those people with this type of insertion. So. So you can just see the makings of the biceps on the left side of the great cannula. You can see how it inserts into the undersurface of the cuff. That little area of fraying is just right there. Again, I don't think that's going to be a significant thing that we have to worry about. Okay, so now we've switched the camera. We're looking from the front to the back. We've moved our blue dry dot cannula to the back of the shoulder, and then here's the front. So. And then there's our great cannula coming in the front. So we can see this labral damage here goes along with the instability. See that? You can see how the cartilage next to it's a little bit scuffed up as well. The labrum looks normal way in the back here. That's normal labrum right at the tip of the little gold crochet hook. But even here you can see the labrum split all the way back to about here. Okay, so we're going to go ahead and start by placing a suture anchor down basically right about here to help tighten up this posterior band of the inferior glenohumeral ligament. So we'll need a spinal needle in just a minute here to check our angle, and then we're going to make a little percutaneous approach, placing a suture anchor right about here. Okay, so you can see our drill guide coming in. And now we drill into the bone, and then into that hole we're going to place what we call an all-suture suture anchor. Okay, once that's buried down, we'll unload the inserter. There you can see the two sutures we're going to work with. Now we'll pull tight because we have to seat the anchor. So there you can see how those are seated now. And now we're going to take one of the sutures out anteriorly. So we'll So give me a pincher tool. Sometimes we use a little trick where we just hand it to the back. So we'll take this suture, we'll pass it back here like that. And then we'll retrieve it here like so. And now we're going to use an instrument called a rasp just to roughen up this posterior capsule. It's a instrument that is sharp on the edges, and in the middle part of it has some ridges, as you see there, like a ton of little mountains. And we just use this just on the capsule just to create a healing response, just like this. You just want to roughen it up and make it like a piece of Velcro here. So you can see the split in the labrum there. See? So we're going to try and cover that up as well. But that's why we're using a suture anchor here. So here's a turn to the left suture hook. This is a 45-degree turn to the left. It's loaded with a black wire that you see there called the super shuttle. We start this by placing the hook right here, and then we just slowly rotate back, and that tells us where we need to go into the capsule right about here. And we'll bring that down. You can see that's a pretty good bite. And then we'll bring this underneath. And there it is right there. So we'll go ahead and feed that through. And we'll retrieve that through the great cannula. Okay, so there's the first step. You can see how that suture goes through the capsule, and then underneath the labrum there, we're going to create a mattress stitch. So we're going to take the second suture out the front also. And I may be able to get it without passing it to myself, but it looks like to be safe, I better use the same technique here. So we'll reach in here, take this suture, put it way over here. Now we can easily reach in and retrieve it just like that. Okay, and so now we're going to do the same thing with our suture hook. This time we're going to get about a centimeter of space in between the two. So we're going to start about here, come through the capsule about here. Capsule here, and now we're going to come underneath the labrum about here. Okay. So now with both sutures passed, now we have to tie a nice knot here, and that's going to snug down this capsule and this posterior band of the anterior glenohumeral ligament. So we have a specialized cutting tool in here. We'll cut the suture tails, and you can see how that's really tightened up that ligament back there. I'm really happy with the way that looks. The next step is to kind of do the same thing in the front of the shoulder. To do that, we've got to switch the cannula. So we're going to place this blue dry dock on the left side of the screen, which is the front of the shoulder. We're going to move this gray cannula to the back. We're just freeing up this labrum so we can reattach it properly. It's kind of healed in a what we call a medialized position, so we use this instrument just to gently kind of free it up a little bit. And you can see how we do it. Okay, so we've used our shaver just to roughen up the anterior glenoid so we can get a good healing response here. And now we're going to place some suture anchors, and we'll show you how we do that in just a minute. Okay, so we've got our first suture anchor, and you can see the position. Let me just show you with our crochet. So 6 o'clock is right here. We're going to anchor down. We've already anchored in the back starting right about there, so we're not putting an anchor right at 6. We're going to start with our anchor right here because we can still get to this point in the shoulder pretty easily. Now we're going to go ahead and reach in here and take out this suture, and we'll take our turn to the left foot and show you how we do that in just a minute. Here's our suture hook. We're going to start right here, then we just rotate back, and we'll do a little bit of a shift by taking the point a little bit inferior, just like that. We'll go into the capsule. So we come through there, and then we're going to come back and go underneath the labrum next. And there we go there. We're going to go a little bit more inferior. So here's the first suture coming out. You can see how that works. Now we're going to do the second one and make a mattress stitch. Put a grasper in the back. And this one we're going to place right about here. So we're going to create a separation. coming through. So this is our first mattress stitch. You can see the labrum is a little bit beat up. You can't change that, but at least we've got that anchored down now. Let me see the, we're going to take a little probe instrument here. It's a crochet hook that we use like a probe. You can see how that's still loose, so I'm going to place another suture anchor right here. Okay, so here's our second suture. We tied that one as a simple stitch. And so now you can see how much tighter the shoulder is. There's two anchors in the front. We didn't use an anchor in the back. There we go. Look, Jasmine, I just wanted to make sure. We did use an anchor in the back. For some reason I thought we didn't. But so we've got three. I'm going to smooth out this edge just a little bit more. So we'll lift up straight up on the shoulder gently. Obviously, you don't want to affect the sutures. And just to give you an idea, we're just looking at millimeters of space here. So this is very much a fine-tuning or polishing, if you will. Okay? And a lot of that will get smoothed out over time. Okay, so I'm happy with that. We're going to go ahead and finish up here, I think, and get you back to the recovery room shortly. Remember, the biceps tendon doesn't need anything from us because it's inserting into the rotator cuff. As we look up at the rotator cuff from this anterior vantage point, we can see that the cuff here looks just great at the top of the screen here. That's the supraspinatus tendon that we're lifting up on there, and that looks just fine. So good luck to you now. Bye-bye.